Trump still contagious? Experts say it's impossible to know whether he could still infect others as his doctor clears him to return to public engagements on Saturday. President Trump said Thursday he doesn't think he's contagious anymore. Most people with COVID-19 can stop isolating and be around others about 10 days after they first showed symptoms. That's provided their symptoms have improved. They have not had a fever for 24 hours and are no longer on any medication to reduce a high temperature. But there's no way to know for certain that someone is no longer contagious so soon after falling ill. Experts say on Thursday Trump said he was still taking dexamethasone, a steroid that can reduce fevers. Dr. Sean Conley said Saturday was day 10 after Trump's October 1st diagnosis and that he anticipated the president's safe return to public events at the time. Since his return to the White House Monday evening, only a few staffers and no reporters have laid eyes on the president by Associated Press published 2251 BST, the 8th of October 2020, updated 650 BST, the 9th of October 2020. President Donald Trump said Thursday he doesn't think he's contagious anymore, but medical experts say that's impossible to know a week after his diagnosis with COVID-19. Most people with COVID-19 can stop isolating and be around others about 10 days after they first showed symptoms, according to the Centers for Disease Control and Prevention. That's provided their symptoms have improved. They have not had a fever for 24 hours and are no longer on any medication to reduce a high temperature. But there's no way to know for certain that someone is no longer contagious so soon after falling ill. Experts say. At this point, there's no diagnostic test that tells you whether a person that's infected remains infectious, said Drive. Benjamin Pinsky, who leads Stanford University's virology labs. There's absolutely a chain of unknowns. President Donald Trump said Thursday he doesn't think he's contagious anymore, but medical experts say that's impossible to know a week after his diagnosis with COVID-19. Trump returned to the White House on October 5 after being released from hospital. Pictured, according to Trump's latest medical update, he completed his COVID-19 treatment on Thursday and had responded extremely well. Earlier in the day, Trump said he was still taking dexamethasone, a steroid that can reduce fevers. In Thursday's update, Drive. Sean Conley said Saturday was day 10 after Trump's October 1st diagnosis and that he anticipated the president's safe return to public events at the time. Trump's aides were weighing travel options for the president, including trips for small events next week. During a telephone interview with Fox Business, Trump said Thursday, "I think I'm better to the point where I'd love to do a rally tonight." He also said, "I don't think I'm contagious at all." Since his return to the White House Monday evening, only a few staffers and no reporters have laid eyes on the president, who has announced updates to his condition via Twitter and a few online videos. His doctors haven't held a press conference since Trump left the hospital, only releasing statements with limited information. We who are watching from the outside only have intimations, I'd even call them hints, about Trump's health and when he might not be contagious, said Drive. William Shatner, an infectious disease specialist at Vanderbilt University Medical Center. White House physician Sean Conley, C., said Saturday was day 10 after Trump's October 1st diagnosis and that he anticipated the president's safe return to public events at the time. Earlier this week, the president's doctors suggested they would work closely with military medical research facilities and other laboratories on advanced diagnostic testing to determine when the president was no longer contagious, but did not elaborate. They have not released any details about his test results, including when Trump last had a negative virus test before he got sick. Dr. Anthony Fauci, the government's top infectious disease expert, said 2 negative PCR lab tests 24 hours apart are a key factor in determining whether someone is still contagious. So, if the president goes 10 days without symptoms, and they do the tests that we were talking about, then you could make the assumption, based on good science, that he is not infected. Fauci said Thursday on MSNBC sensitive lab tests, like the PCR test, detect virus in swab samples taken from the nose and throat. Using these, the president's medical team could hypothetically measure and track the amount of virus in samples over time, said Drive. William Morris, who oversees laboratories at the Mayo Clinic. If they did daily testing, you could watch it go down, Morris said. If his viral load is low, the chance he can spread the virus is low as well. Trump's aides were weighing travel options for the president, including trips for small events next week. He continued to work even while in hospital for treatment, pictured during a video address from the hospital. Another potential strategy: take the president's samples and try to get the virus to replicate in a cell culture, which would indicate it's still active. This approach would be less sensitive than molecular tests and sometimes doesn't work. And it wouldn't be scalable, or safe, to use it more widely for other COVID-19 patients. It would take much longer, cost much more, and we don't have that many laboratories that can do it, Schaffner said. There is a third possibility: novel tests available at some research labs that look for minute molecular evidence that the virus is still replicating in cells. But the technology is still too new to be used to rule out if someone is infectious, Pinsky said. You're not going to get perfection with any of these tests, said Gigi Grunval, of Johns Hopkins Center for Health Security. That's why you need to think about other mechanisms of public health control, like wearing masks, washing hands and keeping socially distant to stop the spread of coronavirus. How long are COVID-19 patients contagious and what makes them infectious? By Natalie Rao, U.S. Health Editor. President Trump's physician Dr. Sean Conley first reported he had mild symptoms of coronavirus on Friday morning, hours after the president revealed he had tested positive for COVID-19. Despite Wednesday's report that he has no symptoms, Trump is still likely contagious, because less than a week has passed since he became ill. It may take anywhere from 3 to 14 days after someone is exposed to coronavirus for symptoms to show up. The average person will develop symptoms within 4 to 5 days. It's now clear that a person can spread coronavirus before they actually show any signs of having the illness. Most research now suggests that can start happening between 48 and 72 hours before their symptoms begin. A COVID-19 patient becomes infectious to others once the virus has made enough copies to give them a higher viral load, meaning there is a sufficiently significant concentration of virus genome in their mucus and saliva to potentially spread it. When an infected person coughs or sneezes, they spray droplets into the air, and these droplets can be inhaled by others. Pinning down exactly how early someone becomes contagious, when they are at their peak infectiousness, and when they are no longer contagious, is extremely difficult. Many studies suggest that people most infectious right around the time their symptoms start. A handful have found people were actually most infectious in the 48 hours before they become contagious, according to Harvard University. That early infectious period is part of why coronavirus is so hard to control. People can spread the disease before they know they have it. And the infectious period lasts a long time. Most scientists think that viral shedding continues for about 10 days after symptoms start in mild to moderate cases, according to the Centers for Disease Control and Prevention. But some more severely ill people stay infectious for up to 20 days. Large virus-containing droplets expelled when coronavirus patients cough or sneeze are still thought to be the primary mode of transmission. That means that being symptomatic makes someone more likely to spread the disease. CDC officials have now confirmed the virus can spread in fine particles, too, acknowledging how it is transmitted even by people with no symptoms. Advertisement: let's block ads. Why?
Show your love for him. Click the link in description. Thanks for watching.